Hi, I'm Diane Lewis, Executive Vice President and Chief Programming Officer of the Paley Center for Media, and it is my great pleasure to welcome you to a very special Paley Impact. This program, the first in a two-part series about media's role during the COVID-19 pandemic, is made possible by the Laurie Foundation, which has been an invaluable partner to the Paley Center for so many years. We extend our warmest welcome to the trustees of the Laurie Foundation and offer a special thanks to Jean and Scott Korf. Never before has Paley's mission been more vital, as media has been the undisputed connector to a nation in unprecedented times. Paley is uniquely positioned to meet this moment with impactful conversations among thought leaders, such as our esteemed guest today, who are utilizing technology and media to help inform Americans during these challenging times. They will share their insights into how breakthroughs in technology are improving forecasting models to educate the public. Before we start the program, I have some brief housekeeping notes. If you are tweeting, our hashtag on Twitter is hashtag PaleyIMPACT. Also, we are excited to present the next event in the series with the Laurie Foundation, COVID-19, and the presidential election, live at 10 a.m. Eastern Standard on Tuesday, September 15th. Now, on to today's program. We are joined by several of the leading experts from the fields of medicine, technology, and media to discuss the vital importance of technology and media in helping public officials and the healthcare industry respond to the COVID-19 pandemic. Joining us today are Dr. Mujeeb Basit, the cardiologist and associate director of the Clinical Informatics Center at UT Southwestern Medical Center, Dr. Susan Bailey, the president of the American Medical Association, Beth Blauer, the executive director and founder of the Center for Government Excellence at Johns Hopkins University, Krish Ramakrishnan, the co-founder and chief strategy officer of the BlueJeans network, Dr. Marc Siegel, Fox News contributor and clinical professor of medicine at the NYU School of Medicine, and Dr. John Torres, senior medical correspondent for NBC News and MSNBC. Conversation will be moderated by Apoorva Mandavilli, award-winning health and science reporter at the New York Times. Please join me in welcoming Apoorva Mandavilli to this conversation.
Thank you, Diane. Welcome to Paley Impact. I'm Apoorva Mandavilli, health and science reporter for the New York Times. It's my privilege now to welcome some of the most prominent and influential voices in the worlds of technology, medicine, and public health to discuss the impact that COVID-19 has had on our world and how technology and media are helping to shape the way our society responds. Dr. Susan Bailey, the president of the American Medical Association, Dr. Mujeeb Basit, professor of internal medicine at UT Southwestern Medical Center, Beth Blauer, the executive director and founder of the Center for Government Excellence at Johns Hopkins, Krish Ramakrishnan, the co-founder and CEO of the BlueJeans network, Dr. Marc Siegel, Fox News contributor and clinical professor of medicine at the NYU School of Medicine, and Dr. John Torres, NBC News and MSNBC medical correspondent. Before we begin, the Paley Center wishes to thank the Laurie Foundation, especially Jean and Scott Korf, for their support in making this important program possible. My first question is really for all of the panelists. How has media and the medical community informed the general public and made an impact in reporting the pandemic?
Well, I can go ahead and talk from the media's perspective. And starting back January, February timeframe, that's when things first started cropping up as far as the coronavirus. Before that, on NBC, MSNBC, all the different networks, I was on TV 4 or 5 times a week. After that, I've been on TV 4 or 5 times a day. And so that's just showing you just how much more information is out there, how much more need for that information is out there. And getting information across through the media, I think, is an important way to do that because it reaches a broad audience. But with the caution of that, I'm very, very careful, and as are my compatriots on the other networks as well, very, very careful to make sure that what we're getting across is scientifically sound, that it has backings, and it's not just the headlines, it's the information behind the headlines. And the news people can use, and that's one thing I try to do, make sure that they have some take-home messages of what they can do to impact their health and the health of their children and their families.
I can give a slight counterpoint to that from the academic medical center side of things. Is the partnership with the media has really allowed us to get the message of personal responsibility and following the health guidelines of your local area to continue to drive the numbers down and flatten that curve. And that synergy has been really important. We as the medical community usually have a one-on-one relationship with our patients, and having a broader impact to try to affect this curve has been really important. And we would not have been able to do that with media. As we look back at the proximity between Memorial Day and July 4th, there was a real concern in the Dallas-Fort Worth area that we would have a significant increase. And working with the media and getting the messaging out of being a little bit more cautious during July 4th has really flattened that curve at that time. And as we're coming up on Labor Day, I think that message needs to be emphasized as well in certain communities.
I feel that from a technology point of view, one of the areas that actually technology helped is actually localizing the news. What's important to most people is how is this pandemic affecting me locally in my community? What is the spread? In previous years, that would have been hard. Nowadays, it's so easy to localize with Google and everything else. I think that did a great job in isolating and helping people with coping with the pandemic because the news is now local and relevant.
I have 2 points I want to bring up. They're a little disparate, but first is that in mid-February, I traveled to Nebraska and went to the National Quarantine Center where they were taking care of the survivors of the Diamond Princess. And they were really, they were the right place for it because they're an incredible center out there. And I learned a lot about the virus pretty early on. And I learned from them how easily transmissible it was and that it had a lot of side effects. But I also learned that it was way more there's a lot more community spread than we realized at the time. So they foresaw some of this, and I reported on it. I don't know if they foresaw it to this extent, but they were certainly modeling it. And the other, and I never forget going to Dulles Airport and having the Custom and Border Protection people telling me, hey, look, people come here, and if they have a fever, they're taking a Tylenol to suppress it, and they don't want to be quarantined, and they don't want to be separated. And so there was a lot of sense that there was a porousness of this coming from different places. And the other thing I wanted to say about this issue of the media, and I think John is right, I think actually ultimately the media has done a great service with two things. One, there's the fact that there's a lot of collateral damage that the virus, that the public reaction to the virus has done, or the lockdowns have done, and that has to be included. But in all the terrible damage that's been done by the virus. But I agree with John's point that the media has informed the public about how to be responsible. The one thing I want to add to that is it's very interesting that it hit New York such a hard, big way in my own medical center because we're the nerve center of the media. So if you wanted to pretend you didn't know about this somewhere in eastern Montana, you saw it on your television anyway. So it hit the nerve center first, so the story couldn't be obscured.
I think there's a drawback to that in that some folks, when they see it happening in New York, and then it doesn't happen to them immediately, it kind of contributes to the COVID fatigue that some patients have had, saying, oh, well, it's not coming here, I don't have to worry about it, which couldn't be further from the truth, obviously. But I think it has been so important for medicine and the media to work together during this pandemic. I'd like to thank my colleagues for all the hard work that they've done in the media, making sure that the message of good science and evidence gets out.
Yeah, and I think from my perspective, coming from the data side of this, in the absence of any real sort of national leadership around data standards, the media has done an incredible job at trying to create some normalized language around how we measure this disease in a way that can be democratized for people like my parents who are looking at the data to determine whether or not they go out and are going to wear PPE or go to their market, and for the people that are working at Hopkins on the epidemiology side. It's been a great equalizer, and without really the media outlets stepping up, we really wouldn't have a continuous language to speak around the outbreak, around what testing definitions are, around what the data look like. And, the standards of how we've really framed this disease and the progression of this disease in our communities has really been driven by the need of the media to not only articulate that standard, but then to hold places like Johns Hopkins University and the COVID tracking project and all of the outlets that have been working really hard on mobilizing, and the New York Times on getting the data out in a way that is consistent, can be compared, so that we can learn and understand from all of the information that we are trying to express during this time.
That's actually a great segue to my next question for Beth Blauer. Johns Hopkins experts have been at the forefront of the international response to COVID-19. And Beth, could you talk about how Johns Hopkins has advanced the understanding of the virus, especially your iconic dashboard?
Right. So, our dashboard at Hopkins started with a professor in the engineering department who had a grad student who had family in Wuhan, China, and they had been tracking other diseases and had been building dashboards. And he came to her and said, there's this virus that's, in the community where my family lives, and I want to track it. And it started very innocently as kind of using the same kind of geographic tools to track the data. And then we quickly realized that not only was there a huge demand from the public, but there was a real absence of an authoritative source on the coronavirus. And that in the absence of that authoritative source, we were now sort of the de facto place that people were coming to for the information. And then I think really getting to Dr. Bailey's point about the sort of localization, we knew that as this disease sort of hit our shores, we needed to tell the story at the most local level. And so that's when we really started to build out a data infrastructure that allowed people to look at their home address and see how the disease is progressing in their communities. Again, I wish that we were not in position to be articulating these standards for how we are measuring this disease, and that we had more guidance, and that there was a stronger voice on the different elements of measurement of the pandemic itself. But in the absence of that guidance, we've been able to really coalesce a group of partners around the articulation of information, getting that information out, but also the validation and really the work behind the scenes to make sure that the data is clean, that the data is accurate, and that the data is actually depicting the disease in the right ways.
Dr. Bailey, you briefly mentioned COVID fatigue. Given that, but just the sort of misinformation out there, as president of the AMA, how has the AMA informed the public throughout the pandemic?
The AMA has been consistent all along about the importance of the basic public health measures of wearing masks, social distancing, washing your hands, staying home if you can. And we've done that everywhere from with PSAs or press releases or, getting on local media outlets whenever we could, and emphasizing the importance of listening to the science, listen to the public health experts, listen to the physicians. Don't necessarily get your medical information from a press release. And if you have questions, ask your own doctor.
Dr. Basit, could you talk about how you brought your prior technological experience to the medical profession, especially during the pandemic and data forecasting?
Yes, so my background is actually in computer science, and I went on after finishing cardiology, did an informatics fellowship in addition to that. And that has been invaluable in this because understanding the data architecture and the flow of information, similar to what Krish pointed out earlier, has been essential to this. We're getting enormously large data sets that, from Johns Hopkins, from local communities, from our health commissioners. That data is generally fairly delayed, and that's not really helpful in terms of forecasting. So we've worked with our DFW area partners and the other health systems who have crossed the lines of competition to get real-time data that is much more informative in how we forecast the data for our local area. Without that understanding of how these systems work and how to talk both sides of not just the medical, but also the technological aspects of the solution has been really helpful on creating a robust solution.
Isn't it ironic that the very tools that we were all criticizing for being the cause of detachment and dissociation end up being what saves us? Child psychiatrists for generations have been criticizing these things. And I mean, look, Dr. Susan Bailey wouldn't take my phone call, but here she is with me on I'm kidding. But in other words, Zooms and in the clinical practice of medicine, telemedicine is something we all shunned for years. We can't do it. Now we're suddenly doing it, and we're learning it and actually loving it. Now we're saying, well, maybe our patient could have a blood pressure cuff at home that will help too, or maybe they should all have pulse oximeters. But telemedicine is something that's really changed a lot of minds.
John, we've seen you on NBC Daily reporting about COVID-19. Can you talk about the challenges of keeping the public up to date on the current COVID information, and also about how you've done that or not done that beyond TV?
And the biggest challenge is actually the amount of information and how quickly that information is changing, and trying to get across also the understanding that a lot of this information is preliminary, because as we all know, those headlines sometimes come out. People tend to get a few sentences into an article, and then they stop there, so they don't get the full story. And that's what I see as one of my jobs, is to make sure that I get the information accurately, as concise as possible, because I typically have a couple minutes to explain things and get them that information, exactly what that means, but also with the understanding that one of the things we're seeing right now, and this is kind of the double-edged sword to media during this time of coronavirus, is one, we're certainly getting that information out there, but also I think it's unprecedented. In the past, and what I tell people all the time, and I do this a lot on some other medias like the Facebook Lives I do and some of the other interviews, is in the past, typically the way science works is research goes on. They'll do a study on 20 people on something, find out a certain finding, out of that study, and then the next researcher will come along and do one on 200 people and get their finding, and then eventually over 10 years, they'll fine-tune that finding, and that's what will come out in the media. Well, now what's happened is the curtains have opened up, and all that is playing out in front of the media. So the media is hearing about these non-peer-reviewed studies that have come out that are just showing this information, may or may not be accurate. And I know Marc does the same thing I do. We get on air and we constantly talk about, okay, that's what you heard, but this is kind of what it means, and there's still more studying to go on to get that. So, that's one of the things I see as the media doing a great job of getting information out there that's accurate. One of the ways we do it at NBC, and I do it, is I have a team that works for me. We have a medical fellow. We have some very bright people that are producers and researchers that look at the different studies, get the information, we boil it down, and every day we have a conference where we talk about what it is and what it means, and then I go on air with that information. So, without that team, it'd be hard to do it as a single person as often as I'm doing it on TV. At the same time, that information understanding is constantly changing, and the message that people are getting isn't necessarily the full message, but I try to get them the information that they need.
Isn't it also true that people are seeming to get some of that information directly too, not just through journalists like yourself, but also access to those preprints themselves through Twitter, just sort of listening into scientists talking to each other in an unprecedented way?
I mean, it is, and one of the problems is, and everybody else could probably attest to this even better, is they don't necessarily have an understanding of what they're reading. Right. And so part of all of our jobs is to interpret that for them, because as I tell people, I spent 7 years learning how to look at a study and understand what's going on. If you never did that, it's not going to make a whole lot of sense to you.
Yeah, we see a lot of armchair epidemiology that's happening, where people are, really trying to, and I think it's this intersection of having to make personal decisions, knowing that you're making that personal decision, that you're having to decide whether you're going to engage in public activity or have people to your home. And also, there's just such an unregulated, huge amount of information that has flooded social media and, the 24-hour news cycle. And I think one of the, real key elements of this is just making sure that we have measured voices that are rooted in the evidence, and that we can consistently all agree and coalesce around the same messages to make sure that we're making the best public health decisions. And, I don't think uniformly we have a field that's ready to have that kind of same sort of uniform voice. And I think that's caused a lot of confusion for people who are trying to consume information.
Yeah, and it seems like also on social media, it's actually hard to tell apart the armchair epidemiologists from the real ones, unless you sort of click through and do some research to figure out who's who. Marc, you've written several books on other epidemics, including the bird and swine flus. What makes this pandemic so different, especially in terms of media and technology?
Well, I was going to say, I was going to answer with the word fear. This because it's way more than a health scare. It's a terrible pandemic that we haven't seen the likes of. I was going to say, everyone says since 1918, all the comparisons between the Spanish flu and the prior outbreaks were way overblown. This one, well, the Spanish flu killed 675,000 people in the United States and over 50 million around the world. I mean, we're not of that order at this point, but still, it's the first time we can really haul that out and talk about it in relevant ways. But my point is, here's my point, and this piggybacks on what John was saying. The fear and the emotion wants us to have answers yesterday to comfort ourselves, but the answers we're rushing to may be preliminary. We may not have the answer. That's why we're reading press releases. That's why we're not reading the primary source. That's why our great journals are withdrawing studies, finding out that some of the data that's never happened before like this. It's the rush to know based on fear.
It's very hard to distinguish journalism from what's reported by bloggers. The blurring of the line of what a blogger says and what like John would say on TV. I mean, how would you distinguish between the two and who's telling the truth? And I think that has caused a widespread confusion, but more importantly, sort of a lack of trust in the news source, and everybody's painted with a bad picture. So the distrust of the media, rightly or wrongly, is one of the casualties of this. That people want to pick and choose their knowledge of whether this is an epidemic, it's growing and not growing, whether you need a mask, you don't need a mask, all that. You can find an opinion for every thing you look for in the media right now.
And I think that actually bleeds into also distrust of public policy making, which makes it really hard for people to comply with social distancing measures and mask requirements, because they have been inundated with confusing messaging, and it calls into question whether or not we should be making these decisions or how serious we should be taking the information in.
Marc referred to this a little bit earlier, but Krish, you're the founder of the BlueJeans network, which has expanded into telehealth arena. Can you discuss how you're using your network for medical treatment?
Yeah. Let me tell you, when this peak happened somewhere, at least where people were looking at quarantine and shutting things down, we received a call from a large university and said, starting next week, the entire state is shut down, but we need to go on to telehealth immediately. 20,000 visits have to be done overnight, for which they didn't have a system. There's no EHR integration, there's none of that. But miraculously, it all worked. And so many hospitals are using BlueJeans or any other Zoom and other product for telehealth. But what is there today is that we are repurposing a collaboration tool for telehealth, and none of the tools have been designed for telemedicine from get-go. So, but people are making to do with it. So version 2 of this, when it all settles down, you would have video systems that are designed for telehealth. That's one of the benefits of using this and pervasive. But I would say this, seeing all this, telemedicine is here to stay. This is not like the pandemic's over, everybody's coming to the building. They're done. We're done with that. I compare this as a technologist to something that happened 35 years ago. Most of you were not born. I'll tell you, it's the actually ATM card. When ATM card was first introduced, it was thought to be like, okay, during off-bank hours when you need critical cash, you can use the ATM card and get it. That's how it was introduced by Citibank. Fast forward 35 to 40 years ago, the switch pendulum has swung. You only go to the bank if you need a critical that you cannot do by the ATM card. The ATM has replaced the teller. Television, it's going to be the same way. You're going to, the routine care is going to be administered through video, and you want to go for something specialized care or something that you cannot get done, surgery and things like that. So that's what I see. That's one of the fundamental shifts that has happened. And I think it is here to stay. And actually, people will benefit by telemedicine more greater, and the cost will come down because of this.
Susan, you've talked about how much telehealth has taken over your profession. Could you discuss what you've been learning over the past few months?
Is that for me? Sorry.
Yes.
My own practice went from 0 to 100% telemedicine almost overnight when the pandemic began. And there are no silver linings in this pandemic, but I think the fact that the telehealth industry has matured 10 years in a period of about 10 weeks, I think is going to be very helpful for us going forward. I think the challenge is that how do we keep it private? How do we maintain patients' confidentiality? How can we make sure that their data is safe? And then how do we make sure going forward, once the public health emergency has ended, that physicians can still get reimbursed appropriately for doing telemedicine, and changing some of the previous arcane rules that prohibited us from being able to do telemedicine unless we were in certain prescribed locations.
And how do you think the media has done in terms of covering the sort of evolving nature of telemedicine during the pandemic?
I think it's been nothing but helpful. I think that it has, people feel so much more comfortable now talking to their doctors and their doctors' offices, their hospitals online. I think because I think the media has kind of helped normalize that type of communication. And I think everybody realizes that if you can stay safe by staying home, then you'll do so. And doctors' willingness to come forward like that and to adopt a new technology that a lot of us, including me, we're not using at all, I think has been very helpful. And there's no question that the media has played a role in letting patients know that that's available.
I think I have the opposite view, Dr. Bailey. I think the media has not covered the benefits of telemedicine. If you think about the media, all you hear is how parents are stuck at home, how they have to do their homework with their kids on Zoom, all this Zoom bombing, all those other things. That's all you hear. Kids at home at Zoom and how it's ineffective in terms of education. But one of the positives is telemedicine, because you can stay at home and get that care, and media hasn't written the positive side of that, of something that is going to revolutionize how medicine is delivered, even including rural areas. This is otherwise people would have to drive 50 miles to get to the closest clinic. This is going to transform everything. And I think that's one of the things that media has failed to cover.
Well, since you brought that up, let me make this a more general question. I mean, what do you all think is the media's role during the pandemic, and what is the medical experts' role, and how do those two go together? Let me actually ask it more as responsibility. What is the media's responsibility during this pandemic, and are they meeting those responsibilities?
I would say the media's role is to get at talk about the data and making sure those who are in authority are holding them accountable for the truth, or some variant of the truth. Today, that has always been the traditional role of media. And that should be the role of media, is to make sure people are accountable for the data they put out. And if they did that, that'll be great benefit for society.
But I also think that media is taking on a public health role. In the absence of public health infrastructure in this country, we're having to rely on the media to get these messages out to the public, to get the right information, to speak the language of local communities, to really make the information identifiable. And I think it is an emerging role. I think that the media is also pulled in many directions right now. We're not just experiencing a health crisis, we're experiencing an economic crisis, we're experiencing a racial uprising. And so trying to find the balance of caring for local communities has been a real important part of the media's role in response to this pandemic. And I think they've done really, I've seen some amazing local reporting. I've seen some great national reporting that is actually, really looking at the intersection of all of these stressors or shocks that are happening across our societies today. And, my hope is that there's a follow-on of research and deep academic dive into all of the impact that the role, this sort of emerging public health role that the media has had to really assume during this time has had, and that we really beef up our public health infrastructure to either support the media so that they can get this information out there moving forward, or that we start thinking about what it means to be a public health reporter, what it means to be a health reporter writ large.
I think Beth brought up a good point, and something that's been interesting over the last few months is the media has done a great job at getting experts to actually help them interpret stories to a certain extent, with the understanding that the media also has a 24/7 news cycle, and so they're constantly looking for those stories that might pop up when they can't get an expert, but they want to get the story on air, so they do as good as they can, and then they follow up with experts. And part of that is the job I do, the job Marc does, of being that expert, that voice that can say, this is what the story really means. But also what it has done is it has put a lot of epidemiologists, a lot of infectious disease doctors, a lot of these doctors that nobody had ever heard of 8 months ago are now almost household names. Fauci probably being the biggest one of those. I guarantee a year ago, nobody knew who Fauci was. And now there's Fauci dolls and Fauci socks you can get. So it's one of those things that they've done a really good job of getting these expert voices out there. But the experts have also done a really good job of understanding that they can't go on to a 20-minute dialogue about what this certain study means. They need to be able to do it in a soundbite if they want to get the information across. And so it's learning from both sides, and both sides are continuing to learn how to merge that. And like was said earlier, it's both the media understanding how to use experts, and experts and epidemiologists and public health experts understanding how to use the media.
I have a couple quick additional comments on this. By the way, to Johns Hopkins gets a nod here because of people like Inglesby and Adalja that have come out, in the Fauci. But I know Tony for many years. I interviewed him today actually, and he's really an amazing example of that. But that's on the positive side. And the other thing I want to say that's fairly humorous is, can you imagine the job we've done getting reports out where we're not allowed, we can't go out with a camera person. John will tell you, we're not allowed to be, we have to social distance. So our camera person goes somewhere, or we're using Zoom, or we're using an iPhone video, or everything. There's been so much great work on the technical side of the media to actually get through this. The one negative I want to say is, and this is a follow-up on John's point in a way, the negative is that a lot of times people are espousing views that may be either politicized or they're underinformed. They may not be the right person to be talking on the topic. They may be, not a physician or not a medical reporter, or there's a lot of opinions floating around and flowing around through this, and they're variable.
I think one of the most unfortunate aspects of the pandemic, and there are many, is that it's happened during an election year, and it's all too easy for messages to be politicized, and for conspiracy theories. That doesn't have anything to do with an election year. It's just what our society seems to be prone to these days. It's so hard to break through the skepticism and help people understand that, yes, you need to pay attention to the scientists, and help explain to folks how science works. In the beginning, the initial mask recommendations were because we didn't think there was much community spread. We didn't realize how much asymptomatic carrier there was, and we needed to save it for health professionals. Then when our data changed, our recommendations changed. But many people interpret that as either flip-flopping or outright lying. And so helping the media has a incredible role that it can play in helping educate the public on what science is, what science does, and the fact that when you have new facts and change your recommendation, that's a good thing, not a bad thing.
I'd like to add from the opposite end of it, as the clinician who often now talks to media, I never thought in my career I'd have more than probably 2 opportunities to be on live TV or in the newspaper, and this pandemic has kind of altered that trajectory. I have been really impressed with how much effort the media places in understanding what is fundamentally a very complex disease process as well as a complex data architecture. And they always come with very informed questions and work really hard to create a clear articulation of that concept that the average person can understand. If you look at the literature that we write, it's designed for other people in the expert field. It's not designed for general consumption. It requires an enormous amount of background understanding to even get through the introduction, in my opinion. And prior to this pandemic, we had large conferences where that debate would happen in, a relatively isolated area. But now we're having that debate publicly and oftentimes on Twitter that has opened up that uncertainty to broader discussion. And that has really complicated this picture. Our patients frequently get frustrated because guidelines change and therefore their treatments change, and they've gotten comfortable with this treatment. And this is happening on a daily basis in terms of the COVID pandemic. And I can completely understand why people would be frustrated and find it difficult. And the media has done a really wonderful job with it. And I think from the media standpoint, it'd be really nice if they would spend a little bit more time helping the providers and the clinicians, learn how to better talk to the public in clear ways that more people can understand.
Well, as a member of the media, I appreciate the fact that you appreciate the effort. But how successful are we being, really? I mean, where is the general public getting most of their information, do you think?
I think it's everywhere.
Just look at the terms now that are in common, parlance. People talk about PPE. They talk about false positives and false negatives. They talk about antigen testing. They talk about placebo-controlled trials. They're talking about emergency use authorization. And they didn't learn that from just going to the grocery store. They learned that from the media. And I just think it's been amazing the amount of knowledge that has been transferred in such a short period of time.
And social distancing, a phrase that nobody heard about a year ago or didn't mean much, and now everybody knows what it means. But also, I think there's with the media, expanding the definition of media, this is another one of those double-edged swords where, when it's a media with experts, physicians like myself and, Marc that are on there that can actually, interpret for people what these things mean, that's one thing. The reporters that go out there and dig in with the questions and have an understanding, that's another thing. And then you have the social media aspects, the Twitter, the Facebooks, all those other ones where a lot of people are getting their information from that either sometimes it's completely erroneous on purpose or it's misinformation, and they're using that as their gospel information. And I can tell you, I don't know if Marc has the same thought, but I can tell you that for me, that's a bit of an uphill battle because those are the questions that a lot of times viewers will ask and the questions that you have to constantly basically myth bust all the things they're talking about. And I've been doing that for months on end. And so that is part of the ugly side of media. That's the social media, the way they're getting information from sources that they don't really understand what those sources are, but they're still using that as something that they go by.
One silver lining I see is we have democratized medical information in some sense, right? And there is some silver lining. Yes, you would get bad information as well. But I think the overall medical information that is now widespread and there's easy access to them, and people can get anything. Google publishes their own how it spread. People know about Johns Hopkins, and I'm not giving a plug for New York Times, I'm fond of the New York Times, how it has that color map, and I go through and how it does the build up in color, and they can even tell me the red state for the blue state. So the entire public is actually well educated in some sense. Yeah, and it's their responsibility to filter out some of the bad information. But overall, I see actually positives coming out of how the media has helped the country, in fact, the world, cope with this pandemic. Without the media, I don't even know how we will deal with this.
Yeah, and I think even in social media, I think we've been able to use the pandemic as a catalyst for some regulatory frameworks that just were absent and that, played really influential roles in the prior election. And now that we can have disclaimers on false information, and there's more of a willingness for the public to accept that Facebook and Twitter are going to have to say this is misinformation, and they're going to have to weigh in on those things. That was something that we've been asking for a very long time, and we've been able to use this moment as a catalyst to get a regulatory framework that will actually help us navigate misinformation and the spread and the virility of misinformation in social media. And I hope that that's something that we can continue, because I do think that there are some very dark places on the internet where we have seen over the course of this pandemic just catastrophic information get out there that has led to the loss of life, that has led to poor decision making. I mean, these are very serious public health crises. And without those, without holding ourselves accountable, we, would be probably in an even worse position than we are now.
To that point, what do you think is the biggest misconception that people have about this pandemic?
And that it's a hoax. I mean, I think that there are still a lot of people in this country that don't believe that it's a real thing, and that's just, it blows my mind. And I'm on Facebook, and the kids I grew up with who are still in, their parents' basement, I'm having conversations with them, and I'm thinking like, I can't believe that this is a real situation where we're having to actually first, like, the threshold question is it real? And I think that whole entire framing, the fact that hoax was even in the canon at the beginning of this was so detrimental to our ability to respond. And it's just absolutely manifesting itself, and it continues to manifest itself.
Yeah, Beth, I agree with that totally. And Apoorva, another way that's manifested itself, and this is to John's point about social media being plus and minus. I mean, clearly there's a lot of people that are being very responsible on social media, but the idea that there's such a non-compliance in advance of a potential life-saving vaccine. I mean, the work towards a vaccine here, so unprecedented and so inspiring. I mean, we don't know how it's going to end, right? But the way that all the science coming together on behalf of a vaccine, and yet we still think that there's a lot of people that won't take it. That's not the same thing as the hoax theory, but literally an effective vaccine or 2 or 3 could possibly really slow this down. And we don't know if we're there yet, but I can't believe the number of people have said already they wouldn't take it.
I think the misinformation about masks has been very detrimental. There are some people that feel like they don't work, that they make them worse, they can get carbon dioxide poisoning or oxygen deprivation. We point out surgeons and nurses that stay in the ORs all day long, working very, very hard behind masks and don't seem to be, dropping at the table. And just the ridiculous notion that somehow we're infringing on someone's rights, that if we're asking them to wear a mask when all we're doing is asking them to protect themselves and to perform an act of kindness for their neighbors. The rhetoric around masks, to me, has just been unbelievable.
For me, the biggest thing has been the initial phase of the pandemic. It was almost like it's the elderly that's going to be affected, and if you're not in that age category, you can go out and party. And that has been the biggest misconception of this. And if you can see, as colleges and schools are reopening, it's the youngsters that are causing the reemergence of this pandemic again, right? I mean, they're on the rise because of the youngsters. So that is one of the misconceptions, that if we had said it affects everybody equally, the end result may be different, but it affects everybody equally, then people may have heeded some of those social distancing rules and wearing masks and so on.
Yeah, I think Krish brings up a good point, because something I've noticed over the last 7 months, and part of this has to do with being in New York when they were the epicenter back in March, April timeframe, is noticing in other parts of the country that people were paying attention to the fact that, yes, this is happening in New York, but it's not something that concerns me. So I don't need to social distance. I don't need to wear a mask. And once it started moving across the country, then they were getting the message, oh my gosh, this is something that hits home. And so people weren't understanding the impact of coronavirus until it hit their community or themselves or their families. And I think that's the biggest misconception, is that this is ubiquitous. This is going to be either everywhere or going to be everywhere very quickly. And the one thing I constantly talk about, which everybody else has brought up too, is some of the ideas early on about the mask and the changing rhetoric on the masks and how people are still using that as a tool of saying I don't need to wear a mask. It's not going to impact me. And I frequently tell people, I said, I don't understand how the masks have gotten to this point, because for decades, none of us have blinked an eye at a sign at a store that said, no shoes, no shirt, no service. You put shoes on, you put shirt on, you go inside. But yet, if they put a sign that says you have to wear a mask, all of a sudden it becomes this inflamed rhetoric where people are getting hurt and even killed over it. So, just the amount of emotion that's gone into this has been an interesting phenomenon.
I want to connect that to what Marc was just talking about with vaccines and the sort of fear that people seem to have now about having to take a vaccine maybe that hasn't gone through all of the safety steps. Given that we're going to be hearing about vaccines now every day until there is a vaccine, what are some of the challenges in keeping people informed as we get closer to that release and to reassuring them that a vaccine is safe, if it is indeed safe?
And I'd be curious to hear from others, but I know from the perspective of myself being on air, Marc being on air, that the biggest thing is to keep them informed, but not keep them scared. And that's always a hard battle, hard line to walk down, because at the same time you want to talk to them about where we are in the vaccine, where we are in the phases, and what it means to get an EUA, that emergency use authorization, versus an approval, even if they haven't completely gone through phase 3. What that means, which could get some people nervous about getting a vaccine, when in fact the data might actually show that it's safe and effective. Obviously, we don't know yet at this point, but right now you're hearing the talk about, well, are they going to approve it too early? And then me getting on saying it's not, number one, it's not an approval, it's an authorization. Number two, I've been told, I talked to Dr. Hahn personally, and he said no, he is going to make sure that it is safe and effective, and that's his bottom line, apolitically. So, getting that message across, at the same time people are getting scared about what's going to happen with the vaccine, that's going to increase that vaccine hesitancy.
I think if you look at the prior press outreach in terms of disease and prevention, I think there was a really, you could study the Kitty-Curric colonoscopy effect probably. It increases the amount of preventative care that is done after the press does something like that. And the emphasis for the vaccine really needs to be that the first people who will probably get the vaccine, and one of the first people, will be all of the clinicians who take care of patients. And the clinicians who understand how to read the data, understand the risk associated with the vaccine, who themselves are willing to take it, I think will be an important message to getting greater adoption.
I think the social media is going to be the biggest discriminator in terms of whether vaccine is going to be successful, whether it's going to be scared. All the scare tactics, not the quote-unquote regular media, it's going to be the social media, and people are going to, that information about vaccine is going to disseminate, and it's very hard to fight those rumors. I don't know whether Facebook or Twitter can actively do anything about it. When I'm really scared about that aspect of this, of spreading false information, and that's going to spread like wildfire regarding the efficacy of a vaccine.
And you're going to see, unfortunately, on social media, somebody get the vaccine and they're going to show their red arm, and I had 100.3 fever, and oh my gosh, this is horrible. Yes, that's going to be unfortunate.
I think the key to all of that is not, when I say, I think the public probably has been informed, and this has to do with what everyone is saying about how well the media has been doing. They've been informed that the steps that are being shortcutted are manufacturing steps so far, and that I think people can get their head around. If they start taking shortcuts on the science, that's going to really make everyone fearful. It's a new technology. But one thing is it's being studied all over the world, which is a really good thing. And I'm looking to see if we see an international cooperation with all of this, because we traditionally in the United States have always relied on our own data. So now one of the vaccines that's really emerging at the forefront is the one out of Oxford. And that is, are we going to utilize UK data, Brazil data, South Africa? How much are we going to make this an international effort? But the actual, we can't shortcut the science, and we'll have less fear. I think I agree with that statement.
Well, and I think honesty and honesty and transparency are so important. We need for the FDA to be very transparent about the steps that they're taking to approve the vaccine. But then I think we need to be very honest with the public when we have this data. Okay, 10% of you are going to get a fever, or 5% of you are going to get a swollen arm. And be very forthcoming about the potential side effects. That doesn't mean that it's not going to. Look at the problems we've had with flu vaccines. There are still people that won't take flu shots because they're convinced it gives them the flu. So we've obviously still got a long way to go in terms of educating the public about the risks and benefits of vaccines in general. So I think we've got to be very upfront with the public right from the beginning when we get a coronavirus vaccine.
And we need to make sure that it actually lands in the communities that need it the most. I think there's also a very big risk that we replicate some of the real ills of the healthcare infrastructure and systems that leave behind particularly poor Black, brown communities. And those are the people that are getting sickest and having the most detrimental impacts by the disease. And so I think there's also a real important role for the media to make sure and hold the systems accountable that the right people are getting the resources at the right time.
I think one of the drawbacks of having this social media and this online connectedness is it's very easy to get into a closed virtual group. And once you're in a closed virtual group, it's hard to get accurate information into that. Going through medical school, we had extensive training on cultural differences among different geographic and regional communities. It's almost as if these communities are also formed that way. And we need some education on how to deal with that. Because, as Dr. Torres was saying, he has to deal with it all the time in terms of questions of this misinformation. I get that from my patients all the time as well. They read something online and we spend half our visit trying to dispel that information. And I think greater training on how to do that effectively will be important. But the nice thing about it is all of this data is now logged. It gives us an opportunity to understand how that information disseminates, how to disrupt the propagation of that information, and how broader communications can have an impact in controlling that ebbs and flows.
And the anti-vax talking points are known. We all know exactly what they are. And if we do this right, we can have a coordinated approach led by the media that really head-on hits their key talking points. But if there isn't continuity and if there isn't a uniform adoption of the same kind of approach, then it leaves the door open to confusion and misinformation.
That actually brings me to my next question, which is really the last question. We're running out of time here. What have we learned from this pandemic and this virus, which really took us all by surprise? But what have we learned from it that we can apply over the next few years? And will we be ready for whatever the next surprise is?
I can tell you from my perspective, what I've learned is that the federal platforms for collecting health information and the strategies were not purpose-built for dealing with an emergency like this. And we really need to invest in a federal data infrastructure and leadership and guidance around information that is pertinent to public health if we want to be able to navigate future pandemics, but even some of the most critical public health risks that our communities are facing today.
I agree completely. I think what we learned was we weren't prepared at any level for what was coming. And it was really the companies and the institutions and the press who was agile and able to adapt and move quickly are the ones who have been really successful for their, the patients that they cover and the communities that are really important. And the people who are not, they didn't do so well. I was surprised to learn that there are counties in Texas where I am that don't even have a health department, or they might only have like one person in their health department, and they have no capacity to do contact tracing or rapid turnaround in their results.
For me, I think in all these things, how the entire world have come to rely on technology. When the country shuts down, people are working from home, all of a sudden overnight everything has to work that people used to go to work for has to work remotely, and the consumer and the customer expects it to work smoothly. But at the same time, technology also can be used in a bad way, and that's some of the challenges. But all in all, positively, technology has stepped in, filled in the void, and actually has made us cope with the pandemic far better had it not had that technology.
Two things. Pandemic preparedness, which was just mentioned, is something where so many of the prior so-called pandemics ended up being health scares that we ended up stalling. And one of the most clear stalling that went on was for the SARS and MERS vaccine, which actually would have helped us here. And so we got funding and then we'd stall and then another thing would happen. But I think this reminded us of the huge importance of pandemic preparedness. Finally, I hope that lesson is learned. And the other thing is that this virus isn't even so much of a killer or a hospitalizing virus because of the virus, but because of the inflammatory response. So we learned, I think everyone, and this speaks to the point about media teaching, that it isn't the virus, it's the impact on the body, on the immune system, on blood clotting. And that's a reminder that we can have an impact of a pathogen that's well beyond just the pathogen. That's pretty scary, but it is what it is with COVID.
I think we've learned the importance of technology and most specifically internet access that we're doing everything online now. We're going to school, we're working, we're going to church, we're going to the doctor. And I've been amazed at the number of my patients in my practice that don't have good internet service and so have not been able to do the traditional telemedicine visit for that reason. We need to make sure that there's broadband access everywhere. Everybody has access to it, and realize that, this is not a luxury anymore. To be able to function in our society, it's a necessity.
And I think what we learned too is a couple of things. One is human resilience. Just if you had told people they would be locked in for months on end with their family, especially with their kids, trying to teach their kids, not able to go anywhere, that they would have thought that would never happen. Well, it's happened. But at the same time, that human behavior is what it is. And so once things start getting better, once things start opening up, people are going to revert to their prior behaviors, and they're going to go to those bars. They're going to go to those group get-togethers and start spreading it again. And that's where the media, I think, comes in very well to keep pushing the message that, hey, even though things are better, cases are getting under control, this is going to start coming back if we don't get back to those behaviors we know that can keep us safe. And so constantly getting that message out there. And I think one thing with media is getting that repetitive message of things we know that work, like we talked about the masks, the social distancing, the hand washing, and I'm constantly putting that in just about everything I talk about, just to get that message across, because people will go back to their prior behaviors. Reminding them that we can't do that yet, I think, is important.
I think that's an excellent note to end on. Thank you all for joining us for this Paley Impact, and thanks again for the support of the Laurie Foundation. If you'd like to see more impact programs like this, be sure to support the Paley Center and consider becoming a Paley member by visiting paleycenter.org. Take care.